our moderator today. Sean, thanks for joining us. And I know we'll hear from you later, but if we can do a quick sound check, that would be great as well. Oh, you are on mute though.
Okay, now I'm not on mute. Now
Okay.
you can hear me.
Perfect. The sound sounds great.
Happy to be here.
Wonderful. Thank you. Appreciate you being here as well too. And oh, are we okay? We're starting, I guess then.
No, I was just putting it up there just so people, while I start moving people over, just so they could see the agenda and whatnot. People still are on. I'm just moving the people that have their camera off.
Okay, wonderful. And just to let you know, we will have a the way this is going to be a webinar, so we're going to be moving people off screen, and then and so only the speakers will be on screen. But at 3 o'clock, if you'd like to stay afterwards for our post discussion, we will then move everybody back on screen so that you can be part of the conversation as well too. So we're going to open that up to everybody as well too. So I can start the discussion. I think we've got quite a number of folks who have joined us. So I'm going to start the discussion. I'm not certain if Secretary Pollack has joined us, but
I have.
Oh, hey, welcome. It's great to see you. Thank you for joining the conversation.
Great to see you as well, Stephanie.
It's great to see you. Well, I'm going to start the conversation and kick us off because I know our time is limited as well too. So first of all, good afternoon, and thank you everyone for joining us this afternoon. Certainly a lot is happening today. It's election day, so we appreciate you spending your time with us. Thank you to our speakers, and we're going to meet all of our speakers in just a few moments. And thank you to our sponsors, including the BSC Group and Transaction Associates. And we greatly appreciate your support, especially during these times. I'm Stephanie Cronin. I'm the Executive Director of the Middlesex 3 Coalition. We are a public-private partnership, which brings the public and the private sector together to address business development concerns. And so for the sake of time, we thought we'd just share some of the information about Middlesex 3 via the chat box. And we ask you to do the same. So if you can put your name, your contact information, anything you want to put in there, it's just really a way to keep and to grow our connections and our conversations. And so many of you know, it's certainly not a surprise that pre-COVID transportation was the biggest concern that we heard from our business community, which is why we created the Transportation Management Association with the assistance of Transaction Associates. And today we're going to be talking about the future of public and private transit in Massachusetts. And obviously COVID has impacted all of us in some way, including how we work, how we travel. It's impacted the economy. We've all had to go through a lot of challenges over the last many months. So we thought today, with it being election day, it's appropriate that we prefer to look at the opportunities that are ahead of us. And so we want to take the next hour and discuss how do we plan for the future of transportation when there's so many uncertainties? How do we meet the changing economy and workforce needs? How do we get people back so that they're comfortable taking public transit? And there certainly is a lot to discuss, and this will certainly be the beginning of what I think for us will be many conversations. So I'm very grateful for our speakers today for their time, for their insights. And so let me introduce everybody. And then give you an outline of the agenda so that we can get into the discussion. First, welcome and thank you to Stephanie Pollack, who's the Secretary and the CEO of MassDOT and the MBTA. And I do want to take a second and recognize your staff. They have been incredible, responsive, clear, just a pleasure to work with. So thank you to them. And Secretary Pollack will start the conversation with a brief presentation on the future of transportation. And then afterwards, we'll have a panel that will join the discussion. And if you know our panelists, you'll know that we're very fortunate to have them here today. They include Sean O'Brien, the President and CEO of the BSC Group. Welcome. Thank you, Sean. Monica Tibbits-Nutt, the Executive Director of the 128 Business Council. Thank you. Welcome, Monica. And welcome to Michele Brooks, the Vice President of Transaction Associates. We're very happy to have you all here today. So we're going to start the discussion with Secretary Pollack. And again, thank you for taking the time. I know your time is limited and you're incredibly busy, and I hope you've been doing well during this pandemic. It's great to see you. And I know you have a presentation which will help us to better understand what's going on at DOT and some of the plans and the thoughts. So yeah, we're going to stop sharing our screen. And I believe you have the ability, or I know you have the ability to share your screen and just move the presentation forward if that's what you would prefer to do, you have that ability. I guess
I'm
we'll do
certainly
that.
going to try.
All right. And so I'm gonna hand it over to you, and then I can jump off the screen, so it's, yeah, the focus will be on your presentation.
Great.
Okay, wonderful, thank you.
All right. So can folks see the presentation?
No, not now. We could
All right.
earlier, though.
All right. Let me try it again. Let's see.
Yes,
There we go. You got it?
got it.
Okay, great.
Perfect.
So thank you so much for having me. I'm, still always sorry that I can't join folks in person because I've always enjoyed my visits to Middlesex 3. You guys do great work. And I do want to try to walk you through a lot that's happening in the world of transportation, but also keep it short enough to make sure that we have time both for conversation and to hear from the wonderful panel that has agreed to join us this afternoon. So that's terrific. So, everything has changed in some ways with COVID. Transportation is a piece of that, but it's hardly the only thing. And I've started to think of it as like a reset button, right? We sort of hit reset back in March and April. The right-hand side, the left-hand side is the pre-COVID world. The right-hand side is our post-COVID world. Now the world doesn't look like that anymore, thank goodness, but things have changed. So I want to talk about 3 kinds of changes that will hopefully spark our conversation. One is the traffic volumes and patterns as we've reopened the Commonwealth of Massachusetts over the last 5 or 6 months have changed. And what that really affects is the thing that we all, a year ago, it's hard to realize it was only a year ago, but a year ago, mostly what we were talking about was congestion. We had just released in August of 2019, a 18-month effort to sort of understand congestion in Massachusetts and how it was affecting all of us, particularly in the greater Boston area, and how important it was for us to really comprehensively tackle congestion and people's increasingly frustrating and unreliable commutes. It's hard to remember that now when some of us work from home and many of us encounter much less congestion on our roadways, but that was the issue. And there's still a lot of concern that it could be coming back. And that's one of the things that I want to talk about this afternoon. So we know that traffic is coming back. This is a chart that starts on the left-hand side here before COVID. This dotted line is kind of COVID. The gray on top is the traffic in the US, and the sort of orange color is in Massachusetts. And this line is sort of where we were a year ago. And so you can see that traffic, hit a trough, has come back. Massachusetts' trough was lower, so we were actually more locked down than the rest of the country. And our comeback isn't as great, but neither we nor the country as a whole is back to the traffic volumes that we saw before COVID. And if you're wondering where you can get information like this, we have a wonderful mobility dashboard, which is online, and that chart and a lot of others are available. This is an interesting one that shows the 3 lines. The red line on the bottom is what our morning rush hour looks like. And what you can see is that it dropped and it's really stayed pretty flat. Rush hour has not come back the same way. Yellow is the total vehicles mile traveled on the weekend. So you can see our weekends are the closest to being where they were before COVID. And then blue is weekdays, and they're below weekends, which is unusual because generally weekdays are busier than weekends. So I think a lot of us are staying closer to home and being really busy on our weekends. But overall traffic volumes statewide are still 9 to 21% below where they were before COVID. We're also seeing that traffic patterns have changed. So this is Route 1. This is the Southeast Expressway. And in each of these next slides, I'm going to show you red is last fall before the COVID epidemic. Purple is this April. So it's pretty flat in most of these slides. And green is our most recent data from October. And what you see here is that this is coming into Boston on the Southeast Expressway. So first of all, the green line is below the red line so that we have less traffic, but also, the morning peak of traffic was much wider. It was very trafficy still in the middle of the day. We never really got all the way down between our morning rush hour and our afternoon rush hour. And now we do have a morning peak, but it's lower. And then we're back to having rush hours instead of rush forever. And the same thing on the evening side. This is the Mass Pike. And the interesting thing about the Mass Pike is you see it's just way below where it was. And this is westbound in the evening. And you can see there's almost no rush hour at all left on the Mass Pike. Here's a corridor some of you may be familiar with. This is Route 1 between Copeland Circle and I-93. And again, you see that the morning peak is smaller, and the green, which represents now, is in the afternoon, also much smaller. So we're really not seeing the traffic patterns we saw before COVID, and we've been reopening for 5 months, and we're not sure whether that sticks. So that's point number one. Now I want to talk, because Stephanie mostly said we were going to talk about transit. And by the way, the reason that I started with traffic and that I focused on the morning rush hour is because it's directly relevant to transit use, in the sense that a lot of folks make a decision about whether they're willing to try driving in to work or wherever they're going, or they're using transit, based in part on how bad they think the morning commute is going to be. And so if we don't have morning congestion on our roads, we may see less incentive for people to use transit. But now let's talk directly about the MBTA and what's been happening to the MBTA. So this is a very complicated chart. All the different colors represent different kinds of MBTA transit. Again, this is on the dashboard. What you can see is all transit use really plummeted. The buses are the mode that has, that's purple, has come back the closest, and the blue line from the North Shore to where it was, but we're still at far less than half of our pre-COVID ridership. And then way down on the bottom here is commuter rail. The red line, the orange line, the green line are somewhere in the middle. And let me talk another minute about commuter rail. Commuter rail had been increasing substantially before COVID. Every line you see in here, this is 2012 versus 2018 data, was seeing ridership increases, and we saw crowding like this pretty frequently. And we were talking about the future of commuter rail, and then commuter rail really plummeted. So we're seeing daily counts arriving in North Station and Back Bay and South Station that are, I mean, this chart goes up, but if you look at the y-axis, it's going from 5% of pre-COVID to 9% of pre-COVID, and none of our lines are really seeing anything close to what they saw. And again, we're 5 or 6 months into reopening. So the sort of what happens to our morning traffic and whether our commuter rail riders are coming back, or whether they're going to telecommute, which is a topic I'm going to touch on in a minute, is a real question. I will also just note, because you're going to hear a lot about it in the next couple of weeks, that this drop off in ridership is obviously accompanied by a sharp drop off in fare revenue, and the T gets over 40% of its operating budget from fare revenue. So it's really, it would be facing a much bigger crisis, but for the fact that we did get a lot of money from the CARES Act, which the T is spending very carefully. And the way the T is approaching this is over 2 years. You know, don't just go through all the money and then hit a wall next year, but spend the money carefully and make sure we save enough money from fiscal 21 to go into 22, assuming that we're still going to be seeing a drop off in fare revenue. And part of that is obviously using federal funding where we can, shifting things between the operating and capital budget carefully so as not to shortchange maintenance or capital operations. Saving money where we can outside of service, but then the fourth piece of that four-port strategy does need to involve looking at service. And so the T is looking at service, because I think we can all agree that using limited resources to operate nearly empty trains, ferries, and buses, it's just not a responsible use of the money. And this is not about permanent changes. The service will come back as the riders and the revenue come back, but we do need to be asking the question. The T needs to be asking the question, and I'll show you some scenario planning in a moment. You know, given the continuing pandemic, is ridership going to come back? And also given changes in where and how people work, learn, and receive healthcare. So that's the last topic I want to talk about for a couple minutes before I turn it back over to Stephanie, which is, besides traffic and transit, what else has COVID changed, particularly that's relevant to transportation? So one thing that's changed is our attitude towards how we share space in our streets among people who are walking, biking, and driving. And we've had a very successful shared streets and spaces grant program. We were able to give grants to over 100 communities across the Commonwealth just between June and October, to repurpose streets, to create bus lanes, to create outdoor dining, to create bicycle lanes and more space for socially distanced walking. We also see from this MassDOT polling data that voters are strongly supportive of repurposing room for both walking and biking, which is in red, and outdoor dining, which is blue. So the governor was kind enough to just give us a second round of money for another set of 10 million in grants, which we'll start distributing later this month. Another big change that we're paying attention to and wondering about whether it's going to be permanent or not is, before COVID, we had seen this unbelievable increase in Uber and Lyft in ride sharing, which then completely tanked. And like I showed you with transit ridership, it's back up, but nowhere close to where it was. And similarly, other forms of shared mobility like bike sharing had really been skyrocketing and then tanked, and they're climbing back, but nowhere close. And we don't know yet whether they'll return to their old trajectory or not. And one of the reasons we don't know that is because we don't know whether people's travel preferences have changed during this time or whether it's a temporary phenomenon. This is some data that was collected in a survey by Car Gurus and some data that was collected locally in a survey by the MassDOT polling group, where people were asked about, do you think you're going to use ride sharing as much? Do you think you're going to use transit as much? And in general, people are reporting, I mean, I guess the good news is they are reporting more walking, but they're also reporting a lot more driving. And, you know, in this case, a lot less interest in using the T, including commuter rail, buses, and subways, all of which you can see big declines. And we also see similar data where people are very interested in telecommuting. So this is how many people want to stay home after reopening. And 39% in this poll from MassInc said every day, and 29% said a few days a week. So that's a substantial majority of the workforce whose attitude towards telecommuting may have changed in a permanent way. This is another similar one from the Pioneer Institute. So this specifically asks, well, first of all, this should not surprise anyone on this call. What do you like most about working from home? Avoiding the commute, number one. What do you like least? Missing social interactions. But then they specifically asked, after there's a vaccine, do you still want to work from home? And that's almost 2/3 of the respondents said yes. And many of them were looking at 2 or 3 days a week, not just once a week or occasionally. So these are the kinds of changes that, you know, could really change both our traffic patterns and the future of transit. To what extent will the move to working from home really stick in a place like Massachusetts, which ironically before COVID was a laggard in the United States in the percentage of our workforce who was telecommuting on a given day? It was only about 5%. And we talked about telecommuting when we released the congestion report back in 2019, and we didn't, honestly, we got a lot of skepticism that was really a thing people would ever do. And so I think that's one of the main things the coronavirus has changed. But before I wrap up, I just want to note that telecommuting is part of a broader set of changes in how we use our transportation system. And back when I was a professor at Northeastern University, I used to talk about the fact that we had transportation backwards. We had confused our means and our ends. We thought that the thing we were trying to achieve was mobility, the ability to drive around or walk around or bike around. And what was getting in our way was congestion. So we had to reduce congestion, and that was the means to the end of mobility. But the new paradigm that I think COVID has really hammered home is that the end that the transportation system is trying to achieve for all of us and our businesses and our families and our communities is access to what we need. And yes, one way you get that is by mobility, by going places, and that will remain true, but maybe less, because we have two other ways of achieving access. One I call proximity, which is putting things closer to each other so that it's easier to walk, bike, and use transit. And that's transit-oriented development and Main Streets development and new zoning that really allows us to use those transportation modes that are better if we're going a shorter distance. But the one that we've really learned about from COVID is what I call connectivity. If we're wired together better, we can access what we need without moving, without mobility. And this slide just illustrates that relationship, that it's what we're looking for is not a crowded commute. We need to work, but we can do it at home. And it's not that we like yellow buses, but we like our kids to learn. And we definitely need healthcare. And sometimes we will definitely need to go to a doctor's office or a hospital. But now we know that for many things, we can use telemedicine. And we all need fresh and healthy food. But we've learned that that may involve a trip to a grocery store, or it may involve delivery. All of these switches from the mobility to the access perspective result in a lot of what I call not travel, not traveling to work, not traveling to school, not traveling to the doctor's office, not traveling for shopping. And we really don't have the tools to honestly model what not travel means for our transportation future. So at MassDOT, we're trying to use what's called scenario planning, which I think I talked about when I was here a couple of years ago when we had the Commission on the Future of Transportation meeting. And the goal is not to come up with one most likely future, but to actually look at a bunch of different futures and have them help us think about the future. So we've spun out three. One where the economy comes back pretty much the way it was before COVID with no economic or travel changes. One where the economy comes back the same way, but travel changes in part because of telework and telemedicine and remote learning. And then one in which we have both lingering economic and travel changes. And what you see in this slide is this dotted line is where vehicle miles traveled would have been if there had never been COVID. And in one scenario, we get close, but this is 2023, and we're still not seeing the same amount of travel. And in these other two scenarios, we're substantially 20% less vehicle miles during the 6 to 9 a.m. weekday period. And similarly on MBTA ridership out in 2022, here we're back up to 90%, but down here we're still substantially below. And the last thing I just want to mention is that we talked a lot about change this afternoon, but the other change that I would be remiss not to mention is climate change. We're up to 42% of all our statewide greenhouse gases coming from transportation sector, and it is just not possible to address climate change in Massachusetts without addressing transportation. And you can see from this chart that we've been really flat with our transportation greenhouse gas emissions while our electric sector is really carrying the load, to use a bad metaphor. So as we think about change in the transportation system, we have to think about climate change. And in fact, there's 5 things I would argue we have to think about, because this is what hasn't changed. We need to provide transportation that's safe. We need to get people where they go reliably. We need to provide access and think about access, not just mobility. We need to address the sustainability and resiliency of our system in light of climate change, as you can see in this picture of the flooded Atlantic Avenue and Aquarium T-stop. And something I think we've all had a lot of time to think about in these recent months, we need a system that's equitable, that works for everyone in every kind of community, in every corner of the state, whether you're a worker who can stay home or shift your travel time, whether you're a traveler who wants to use transit or share a ride or needs to drive, the system has to work for everyone. And even with all these changes, that's the system that I look forward to talking to you about this afternoon. So Stephanie, I'm going to unshare my screen and you can take it away.
Wonderful, wonderful. Well, first of all, thank you. That was a lot of great information, certainly a lot to process. It was very interesting to see and to get an idea of the discussions that are going on at DOT. And I know you need to jump off at 2:30. So what I'm going to do is turn it over to our—
I'll hang until 2:45 because I—
Beautiful. All right. Thank you. Wonderful. So I'm going to ask Sean, Monica, Michele, and I think you know all of them, and you've worked well with as a partnerships with them as well too. So I think it'd be a great discussion to really pick it up from here as far as, you know, the public and private collaboration as well too. And so Sean, I'm going to hand it over to him as our moderator to start the conversation and to get the ball rolling.
Very good.
Perfect.
Thank you. I've got a Stephanie, thanks. Thank you. That was a great presentation. It's clear all the work that you and your staff have put into it. And what a great perspective to share today, that we really have an access problem, not so much a mobility problem. And I think it's great that you've kind of redefined and maybe refocused a lot of people that way. And also, it does a really good job of not only the challenges that you have, but also the things that we have as employers, the challenges that we have, and then as individuals. So going forward, how are we really going to look at this as an access problem, as a mobility problem? Before it was always like, well, how do we get people in the office so they can sit in their seats? And that might not be the case so much anymore going forward. So looking at it through the lens of what access might need to change to get better connectivity, I'd like to explore that with you a little bit, because you're the one that has the most limited time here before we turn it over to the others. But given what we have learned during COVID, and COVID's been a horrible thing, and I think we can all agree with that. But there's definitely lessons that we're all learning. I think we're all doing things that we never thought possible in the past. What do you think is possible now that maybe you personally might have thought possible, but maybe you might not have thought you could convince other people are possible? So I'm curious, during this COVID adventure here, you're probably doing things that many of the people around you might not have thought even possible 6 or 8 months ago.
So it's a great question, Sean, and thanks for asking it. Before I was secretary, I used to joke that the hardest job I had was that I was the volunteer leader of the transportation committee in the community I lived in. And one of our jobs was to mediate between folks who wanted parking spaces and folks who wanted bike lanes. And that's like harder than anything I've had to do at MassDOT, at least until COVID. So one of the things that I think is possible now is to have a conversation in our communities and our neighborhoods about how we allocate the space that we use to travel in, between people who walk and people who bike and people who are getting on and off buses. When I started as secretary, 0 miles of bus lanes in the entire MBTA service area. If we continue to execute, I think we could have 50 miles of bus lanes by the end of next year. And that involves a sort of a societal consensus that it's important to reallocate that space, or to reallocate it to bicycles, or to reallocate it to outdoor dining or curbside pickup for small businesses that now understand that they have to be mini fulfillment centers for their customers. So that excites me. And the fact that we had over 200 of Massachusetts' 351 cities and towns choose to apply for these grants that we gave, and that we were able to give grants to over 100 to experiment with what we call quick build. Let's throw up some cones, let's throw down some paint, let's change some signs, let's use space differently. And then if it works, great, we'll make it permanent. And if it doesn't, we won't. I think that's like a fundamental changes in people's sort of understanding, because we're all looking for some elbow room to be out walking and pushing a stroller and being with our kids and using transit. So I think that's the big change, that and the not travel issue. How sticky are we going to be as a sort of a knowledge economy here in Massachusetts? Are we going to continue to take advantage of telework and telemedicine and remote learning? Not necessarily for our school age kids. They probably should be back in a classroom, but for grad students, I just think the possibilities are endless, and COVID has been a horrible experience, and it has devastated families and communities and small businesses. And I hope that there's just a tiny little silver lining in there somewhere, that it helps us reimagine things that before seemed unimaginable.
That's a great answer. And we certainly do have a lot that we could potentially reimagine here. But I have to ask you, how much of what you think we might be able to reimagine might be attributable to the fact that, employers, restaurant owners, hotel owners, et cetera, have all changed their expectations and have also learned during this time as well?
So I think that's a really important point, because I may be the Secretary of Transportation, I don't get to make all the decisions, right? The decisions about what our communities are like, how we travel, how we work, are all made collectively, individually, and then collectively at the community level by employers, by businesses. And we need to work with each other in a way that we haven't maybe in the past to have those conversations. I think COVID enables conversations we couldn't have, but it doesn't obviate the need to have them. And there's one other point that I want to make under the heading of equity, which is, when we have the economy back, and all of us hope that that is sooner rather than later, we will continue to rely not only on those essential workers who have gotten us through the coronavirus pandemic, but on another set of workers in industries like hospitality who have not been, either telecommuting or working. And we want them to be back to work, and we want their businesses to succeed. And they will always need mobility, and they will need their customers to have mobility. So I'm not talking about everybody sits home all the time forever and all the businesses that relied on human beings to go places go away. But I am saying that we actually clear out more of that congestion in the system, both the transit system and the roadway system, for when we really need it. If we think about which things we can do without moving around, and which things we value moving around, and we want to make sure that people can, support local businesses, have entertainment, participate in recreation. There's still a lot that we all have to travel for. It's just if we can get some of that travel off the road, and in some cases off the rails, then we'll use it for what we really value.
Oh, that's great, and I think we've all seen, and I think it in some instances, it really doesn't take much. It's not linear, the relationship between traffic and congestion. It really isn't. You hit a tipping point, and then, once you exceed capacity, there you go, there you have it. But I want to move forward on something that you said previously about, the relationship with business. And I want to direct this one to Monica and Michele while they're on here as well. I have gotten more familiar with 128 Business Council and Transaction Associates. And I want to start with Monica first. And I was thrilled to see on their website, they made reference to access as opposed to mobility. So I wanted to give Monica a few minutes to talk about maybe her observations and maybe comments on your presentation, Stephanie. Monica, go ahead, please.
Yeah, I mean, obviously, access and options is something we talk a lot about. This is something that I know the Secretary talks a lot about. And I think especially now when we're working with our companies, whether on the community side, the developer side, residential side, obviously everything has changed drastically. I think residentially, the housing patterns and I think the residential development is going to change. And I think a lot of that is really going to be looking at where you can build more affordable housing. When I say that, I mean a full spectrum of housing, where you can better locate housing near transit. And I think that's going to have to continue to be the focus. And then I think when it comes to companies coming back, we're seeing a couple different things. With our life science companies, obviously they are coming back at a different rate than I think other businesses throughout the Commonwealth, but the way they're coming back is slightly different. And that's whether if they're doing, desk reservations, lab reservations, and then also looking at how they configure their sites. Do they actually need more space? Because as the life science companies are obviously working very, very hard to respond to COVID-19, they need to expand their workforce, they need to expand their laboratory space, and they're going to have to do it in a relatively quick manner. And so I feel like when we're talking about those companies, the transportation needs have changed. It's not just that they are making different connections. It's not that the employees are coming in at different days, they're coming in at different times. And so I think that has been a really, really big shift that we've seen. And also the span of the workday has changed. So normally, you have the 4 hours in the morning, 4 hours in the evening. That's kind of, for the most part, you capture most of, the commuting. But now we're looking as early as 5 to 6 o'clock in the morning, going into quite late in the evening. And so then it's how do you alter a system that is built around traditional commuting to now accommodate the fact that people are coming in and going at so many different times? And that's before you even get into one of the major issues we're running into is capacity. As our ridership has come back, we are over capacity, because for us, we usually are kind of in that 32 to 36 passenger range for our buses. For the 32s, right now, we can only carry 8 passengers. We are working obviously with our epidemiology team to look at ways that we can increase that, but that is not a lot of people. And the cost has increased by 23% for us. I went ahead and ran the numbers, 23% increase in what it costs for us to provide these services. So I think our big concern is being able to have enough equipment to be able to move the amount of people that we're seeing. Our ridership is continuing to grow. Now, when I say that, we're talking very low numbers and they are increasing. But I think our big concern is how are we going to be able to respond as the Commonwealth starts to, I don't want to say reopen, but kind of readjust, how we start to readjust our economy. Because I think Q1 and Q2 are going to be very, very telling from a transportation standpoint, because Q3 is really kind of the marker, I would say, for the majority of our clients that they are planning on coming back. And so I just think so much is up in the air. And I think my biggest concern is making sure that we are aligned as transportation providers with the private sector, but then also with the municipalities, and making sure that we're taking into consideration their economic development needs. Because if we are not able to respond to that, as the economy comes back, we're going to be putting a lot of businesses out of business, and we're going to be putting a lot of communities in the position that they need to make choices on whether to continue to invest in alternative transportation options, or if they need to shift that to other services that the members of their community need.
So Secretary Pollack, I started with Monica on that one because I knew full well that a lot of the people that are relying on her organization do lab work, which requires, that's on site. So their access they've got to be physically present. So I wanted you to maybe, share your ideas about, kind of how MassDOT works with, these companies like 128 Business Council to get people working together to the spot that they need to get to, and how you see that working in the future.
Yeah, no, and as always, Monica has great insight. And I do think we're in this interim period where we still have to very much respect the virus. And as she said, that really limits the way that we can cost effectively run shared transportation, because we just have to keep people socially distanced and safe. I think we're all looking forward to the day when we're past this interim period and we can really start to build on the changes in people's travel preferences to sort of give them a better range of options. But in the near term, you're right. Life sciences, manufacturing, there's our grocery stores that we all depend on, parts of the healthcare system, they need people in. And right now, honestly, the biggest advantage they have is that if you have a car, or you have exclusive access to a car, the roads are a little better. But for our workforce that doesn't, the options are really not nearly as good as they need to be. And we do need to do a better job of working with folks like Middlesex 3 and 128 Business Council to understand, are there things we can do to help them bridge that gap between when we don't need to follow COVID protections anymore and when we do, but how do we get people to those workplaces? Really, most of it falls at this point on either the employees or the employers to figure that out with the help of groups like the 128 Business Council, but those don't exist everywhere in Massachusetts.
Thank you. And Michele, I think we have to still be talking about how we keep people safe, how we keep our riders safe, how we keep each other safe. It's interesting, as we're bringing people back to the workplace, one of the things that, we contemplate is okay, how do we keep our workers safe? Well, we can really only focus about what happens in the building. So we've got that covered. But the reality is most of the risk is actually incurred probably on the way to work, at lunch, and on the way home. That's where the greatest risk of exposure, that's where all of the variability lies, the things that I can't control. So Michele, you'd sent over a presentation, and we'll have presentations at towards the end of this. But I'd like you to talk about some of the things that you folks are doing to keep your riders safe, and what you're recommending to others, and kind of how you see it transitioning as we go forward. And hopefully, unfortunately, we're in a situation where things have gotten worse as opposed to better, as we're all inside a little bit more. But where do you think this is going, and what do you think that we can do from a transportation perspective to keep people safe and confident in taking, whether it be a bus, rail, subway, etc.?
I think we've touched on a lot of the things already that are so important. I think flexibility is the key word. As Monica said, I think it's going to be a long time before people's workday and work week looks the way it did before. So I think what we're hearing, what we're talking to people about is flexibility, not going into the office every day, but 1 or 2 days a week. Because, some of the things we were talking about before the call on the sharing session, collaboration is important. And I think that that's what comes up, when you start to talk about people being home for long periods of time without being in the office to work with others, is that lack of collaboration. So I think flexibility is going to be key going forward. I think, a lot of the work we do at TMAs is helping people, across all modes. So I think, as the Secretary suggested, it's not just looking at shuttles and public transportation, but are people more comfortable getting into carpools with people that they know, and creating sort of pods that can work together and can commute that way. So I think it's looking across all of those modes. And I completely agree with Monica that sort of what we're seeing now is very sector specific, right? The way people are thinking about transportation is very much dependent on the type of work that they do and what their workforce looks like. For us, we had to become experts really quickly in a lot of areas that we never thought we would need to know anything about, chemicals and products and cleaning processes. And I think that that's how we build people's confidence in coming back to help them to understand all the things that we are doing, looking at best practices, the things that are in our control and the things that aren't in our control, and how we can help people make good decisions.
Excellent. Well, Secretary Pollack, I know that you.
I could just add one point,
Sure.
because the governor actually made this just yesterday. We are the most comfortable in our cars and our homes because they feel like safe spaces, and that is safe if the only people in those cars and homes are members of your household or your pod, if you're podding. But one of the points that he made yesterday when he talked about the revised mask order, and you'll actually see it on our variable message signs if you're driving on our highways, is if you are in the car with someone who is not part of that household or pod, whether that is driving a kid to school or your teenage kids and their friends or people who are carpooling, we are not discouraging carpooling. But we are saying that unrelated people in a carpool need to have face coverings. And we have started to see some cases, for example, at construction sites, where workers frequently will meet up and then travel together in one vehicle to get to the construction site itself. And there appears to not be mask wearing as a sort of norm in that setting. And then there are cases. So one thing that I would say to everyone, and that we will be emphasizing with some public campaigns and some videos and VMS signs and the governor's new order, is unless you are in your house or your car by yourself or with people that you are already in frequent contact with, put on a mask. It doesn't mean you should not use a carpool or an Uber or share your car with someone. We need those options. A lot of people need those options. But to make that option safe, the single most important thing that has to be consistent is face coverings.
No, thank you. And I want to be respectful of your time. I know you've got to leave shortly, but I do have another question I'd like to direct to you, Secretary Pollack, is, and it kind of plays a little bit on what you were just talking about, the safety pieces. But what's going to happen at the end of the day is people have to trust that it's covered. People have to trust that they're safe. And, all of us, we sit here, we attend a session like this, and, we see the hard work that you and all the thought that you and your team are doing and coming up with a plan and the things that you're considering. So, somebody like me, we look at it and go, all right, they've got it covered. But it's a harder to do with the rider because you don't have the audience like you do with us. You don't have the ability to message like you do with us. They might not be as interested in the details as many of the folks here on this call are. But how do you get them to trust that it's safe? And, you got to give them the confidence. They've got to be positive about it. And you're also dealing with a lot of people that are in a weakened condition, meaning this has been going on for a while. So there's fatigue. And then there's the mental health that people are starting to creep in. Whenever there's long-term fatigue, people start to, for lack of a better phrase, kind of get off their game, off their norm. So they might be more sensitive to things. how do you overcome that? Sorry, that's a big question as a last one, but
It is. So
it's one I had to
how
ask.
about this? I'll start it, but I know that both Monica and Michele have a lot to contribute to that conversation.
Thank you.
So you're absolutely right. In the near term, particularly our transit riders, they need to trust that we have their best interests at heart and that we are doing everything possible to keep them safe. And then when we get to that happy day, when we're sort of past the worst of the pandemic, they have to trust us again to come back, right? Because we will all have ingrained new travel habits, and we want, we don't necessarily want people to go back to all their bad old travel habits, but we definitely want them to go back to the habit of using transit and shared mobility wherever they can. So I think there's a couple of elements that are important, right? So one is communication. You can't, and every employer who's bringing people, just as an employer who has, my registry clerks have been in every day since the pandemic started. The people at our maintenance depots, they can't do their jobs either. So as an employer, this, as a human being, this. You need to communicate with people, you need to listen to people, and you need to reinforce the message over and over again. You can't just say once, don't worry, we're cleaning, we've got it, it's fine. So I would say that communication and sort of constant reinforcement is part of the basis for trust. And another one, and I want to commend MBTA General Manager Steve Poftak for this, is some of us, sometimes we just need some third-party validation. And one of the frustrating things earlier in the pandemic was that the transit industry didn't have a best practice standard. So we couldn't say to MBTA riders, hey, we're following the blah, blah, and that keeps you safe. And the T really pushed the American Public Transportation Association, and they now have a health and safety commitments program. And the T was one of the first systems to join that program. And that does allow us, not just we're telling our riders, hey, we're cleaning the correct way and we're following the right rules, but there's a set of standards that we need to follow. And we can then advertise to our riders, we are part of the health and safety commitments program. We have this third-party validation that if we follow those rules. And the truth is, and this is where I will end, if you look around the world at transit systems that are much busier and more crowded than ours, whether in Asia or Europe, we're not seeing transit as a major vector of spread. There is a way for people who need transit or other shared mobility forms to use it safely. And it's on us, first of all, to make it safe. And second of all, to create that trust and reassurance that it can be safe, because staying at home or driving are not options for everyone. And it's our job to make sure that everyone has good and safe options. So I'm going to end there, but I'm sure that both Monica and Michele have more specifics to add. And Sean, thank you for moderating this and for the great questions. And Stephanie and Middlesex 3, thank you for hosting this and also just for what you do every day.
Well, thank you. And I just want to jump on and thank you for your time and for sharing the presentation and your time and insights with us. And I know this is the beginning of an ongoing and changing conversation. So we look forward to hearing more and continuing the conversation. So thank you very much.
Thank you, guys. Keep up the good work.
Thank you. And before I jump off, Sean, I do want to just remind people we're going to wrap up around 3, but at that point we'll bring people back onto the screen if they want to be part of the conversation, to have more of a casual conversation with the panel. Does that work for everyone?
Works for me.
Okay, I'll jump back off.
Okay. So I want to just kind of go further a little bit with Stephanie Pollack. Fantastic. Secretary Pollack did a fantastic job today, and she also set us up for the next step, which is, recognizing that many of us have to get to work every day. That was the second to last thing she said before she said thank you. So maybe we can just talk a little bit about, we can start with you, Michele, and what you folks do over there at Transaction to further that cause, and not just as it relates to mobility, but also now with the new paradigm that we now all understand, which is access. Maybe you can talk a little bit about that.
Yeah, I mean, I think what the secretary said is critical. It's communication, but I think, because I think, there are protocols that we're following, but if people don't understand sort of what we're doing, people want just the facts, right? They want to know what we're doing. They want to know, what steps we're taking to protect them. So I think that that's critical. For us, it's always been about presenting people with customized solutions. And so I think that's kind of what's going to be essential going forward, right? Is looking at the data. This situation, I think we've all said about 100 times, is evolving. It's changing. There's no way to sort of just like put down some roots and say, okay, this is what we're going to do. We have to be constantly staying on top of what's happening and what's new, what's going on, not just in our industry, but what's going on in our partners, and how people need to continue to work going forward. So I think that's going to be essential for us, is being able to change as we go, to change on the fly, to see, learn what we need to, and figure out how to apply it quickly so that we can put people in position to be successful in their jobs every day, and how they get back and forth. I think, I know we don't have much time. I don't want to take up. I don't know if Monica, you wanted to add anything to that, or if there was anything else that you wanted me to add to that. Ron, sorry, I got off on a.
No, it's fine. I know that there was some prepared presentations, and I wasn't sure if you wanted to kind of go in that, kind of flip through those slides, or how we'd facilitate that. And then Monica, I'm going to ask you the same thing, because really the question that the secretary set us up with really allows for this. And I know you guys put some work into this, which is great. So. You can go ahead, Michele, and then we'll go right into Monica right after that, please.
Yeah, for sure. And I won't take up too much time, because I want to make sure, Monica and gets a chance to talk about what her work, and also that we get a chance for some questions. You want to flip to the next one there, Erin? I think, Erin, you're controlling it, right? Yeah. So this is just a little bit about who we are. We'll share these slides afterwards. I'm happy to also, share any additional information. Helpful, I think, to note, prior to COVID, we had about 130 shuttles on the road every day in our shuttles division. Right now, we have about 44 on the road. So, certainly a change. We're definitely seeing things kind of move in the direction of people putting some of their services back on the road, but nothing like what we saw, prior to COVID. Flip to our next slide. We all wish that we had the crystal ball and we could see what was going to happen, but we don't. And so we have a lot of uncertainty, and it's really hard to plan for uncertainty. So I think it's really about us, like I said, trying to become experts in areas that we never thought we'd need to know about, and then try to address people's concerns in this evolving situation. Where are they going to be working? When will they be going to work? As Monica said, the schedules are not anything like what they were, prior to COVID, right? Where people kind of went in and left at a certain time. Things are dependent now on where your kids are at and what your daycare looks like. And there are so many other factors to consider. So I get to the next one there. So my kids implored me not to use this example, but I'm going to just go dive right in and use it, because I think it's important. This is kind of an extreme way to look at it, but I think people come from, a lot of times, one of these two perspectives. They either really come from a Spock-like analysis, right? They like to know facts and details and information, or they bring more emotion to it. They come from their Captain Kirk perspective, where they lead with their emotions. And so I think we need to be able to respond to both of those as we're looking at the transportation of the future. We need to have the data and the facts and the information, and we need to put protocols in place to address that. But we also need to understand how people are feeling, and we need to see where people are coming from, because in order to make people feel confident, we're going to have to make sure that we're addressing that as well. We'll flip to the next one. So this is a little bit of what we've been doing and how we've been communicating. And I couldn't agree with the secretary more, that it's about communication, and it's about appealing to people's both understanding of the facts and their emotional reactions to the facts and to what's going on in the world today. So this is about putting policies in place, and these are a lot of the things that we're doing here, but it's also about making those policies clear to the riders. And I know Monica's going to speak about that, because she's done an outstanding job of putting a lot of that together, ways to communicate the message. Next slide. And I know I'm going kind of quickly, and these are kind of like the 3 A's that we've used as our approach. How do we meet people's needs? I think that what we're hearing so much is that we are looking at a hybrid workforce, at least for the future, that the foreseeable future, where some people are staying at home, but they're not staying at home every day. And I think that we need to allow for whatever is required going forward. Right now, that's the space that we need for social distancing. And as Monica said, that impacts your transportation planning process, right? To ensure that we have room for people to spread out. And I know Monica will speak about as well, the enhanced cleaning protocols. We need time to do those things. Those aren't just sort of things that we can just plop in and say, okay, now we're going to do a lot more cleaning. We have to figure out how that fits in to the day. So I did want to talk, next slide. Erin, thanks. I did want to talk a little bit about a solution that's been working really well in Middlesex 3, this idea of sharing shuttles. So, and this is where we have, right now we have 4 different employers who've been sharing this shuttle. They've been partnered together for quite some time on this. And this allows them to bridge the gap right between the first mile, last mile, or what I guess we can call last mile plus, because it's more than a mile, to make that connection to transit out into these suburban locations. But by sharing the shuttle, they've lowered their costs. They're filling the gap that they need to be filled, and they are increasing their riders' comfort level. Because I think what we're seeing is, you know, that's what people are confident in right now, and making sure that they can be spread out and they can feel comfortable in their environment. So the next slide, I think the secretary talked a little bit about this as well. I think, you know, if you look at it one way, you know, we're all in this horrible situation, but we have been given in some way a unique opportunity with this reset button. And people returning to work are at a decision point in their lives, and we can engage people now in meaningful conversations around their transportation and what their transportation is going to look like. Then I think that we can help them to make better choices in the future. That's all I have.
Thank you, Michele. Great job under pressure. That was a lot to get out in a very short period of time. And you know, this is great the way this whole thing worked out. I was really pretty pleased when I saw everybody's presentation this morning. You know, I think the secretary did a great job of setting us up as far as what we can expect from the state and the way they're viewing the problem. And I see, Michele, what you guys are doing, Monica, what you're doing, as filling in that last step. I think, Michele, you just referred to it as the last mile or the last mile and a half. It's not a shorter distance anymore. Monica, I'd like you to go through your presentation and then really stress some of the things you were stressing when you spoke earlier, which is getting people to the location at the right time, and the capacity considerations, frequency, and safety considerations that you folks are working with your constituents on.
Well, in the interest of time, I'm only going to go to one slide. Erin, could you please pull up slide C?
We still have
Perfect.
5 minutes if you'd like. It's up to you, however you want to handle it.
No, I think this is okay. I am usually not a slide deck person, so this was already going a little out on a limb. So we'll go with this. So, you know, as I mentioned, back in March, the Business Council hired an epidemiologist. As Michele said, none of us trained for this. This is not our area of expertise. And so working with our research department, we just came to the conclusion, if we're going to learn about this virus and learn about the best ways to protect our riders, we need an actual doctor to work with. And the biggest thing that she said was communication is going to be the hardest thing. Communication. That is going to be where you struggle. We had her go through all of our operational procedures, every single thing she went through to start to put together, well, what are the areas that are dangerous? What are the areas that we really need to think about? And I think we are also in kind of a unique position as opposed to transaction in that we don't work with just one vendor. We work with multiple bus vendors. So we really needed to create protocols for ourselves that we would then be working with our vendors to carry out. That was very, very important. We wanted to make sure that we understood and we could control anything that we could control. And I think that was the big thing for us. If we can control it, we have to. So some of the steps we did is, I will just go through these very quickly. I mean, most of the people on the call are very used to this at this point. But in addition to reducing our capacity, we changed the way we clean. I think our industry was very, very slow to come up with recommendations. And so where we were is we weren't going to wait for the industry to tell us what to do. We were start to come up with our own methods, really based on what epidemiologists were pointing out that needed to be done. So that was everything, obviously, from capacity reduction. But the way we actually handled the space was making sure that our drivers were behind driver partitions, making sure that every rider was wearing a mask. It is not only required on a shuttle, We will provide it if you do not have a mask. The other thing is putting staff at the stations themselves. Obviously, normally people just board their bus, board their train. They don't have an interaction with an employee unless something is wrong. For us, it was one of the best ways to control the spacing between our riders while they waited. And it was the best way for us to control the driver not having to interact with the rider. In addition to that, being able to tell, does someone look sick? Are they wearing their mask? And also using that opportunity to educate them on why we are doing these things, to educate them on why they need to listen. That has been very, very big for us. And obviously, as time has gone on, it's changed. As you've seen these GIFs, we talked a lot about how to properly wear your mask, because every morning we had someone with their Dunkies cup thinking that somehow the Dunkies was preventing them from spreading something. And so this was not only sending out to the rider list, out in the field, it was sending it to every company and every member we have, and sending out to every municipality that we work in. We flooded people with this information, because it wasn't just about protecting our services and our clients. We wanted to make sure that we were sharing all of the knowledge that we got with everyone else, because I think a lot of people just did not have access to a research team, didn't have access to designers to actually come up with this. So we wanted to make sure everyone was on an even playing field. Then as we got into the cleaning, as I mentioned, we weren't doing exactly as the rest of the industry, we were going above and beyond. So instead of just spraying, we were using UV lights. And then we are also setting up exactly what chemicals we use. When do we use them? Who is actually cleaning the bus? That was another thing for us, is controlling every person that stepped onto that bus. All of these things had to be put in consideration and put into practice before we actually felt comfortable putting the services back on the road. And now, as we're evolving through this, things are changing. And I think especially as the infection rates are going up, it's clear that everyone needs to kind of be reminded why we are doing these things. And so the other thing here is our new campaign is called Quiet is Kind. There have been a number of confirmed cases of transmission in mass because people were talking in confined spaces. And so that made us very nervous, because it wasn't just something we had to consider on the shuttles themselves. It was something we had to consider in the stations, and something we needed to consider on the company side before those people got onto our bus in the evening. Prevention is additive. That is the way that we are going to find a new normal and find a way to exist within this new normal, is to focus on the prevention. This is something I feel that a lot of doctors have tried to say publicly, have tried to put out into the press, and it's just for some reason not quite sticking. So this is something we say all of the time. And as I said, if you can control it, you have to control it. We cannot put a price on our riders' heads. And I think that's been my biggest concern. As I mentioned, we've had a 23% increase in the cost of providing these services. We are a nonprofit. So obviously, much like every other transit provider, we're in a tough financial position. With that said, we were confident and we were solid in the fact that we would not change protocols to reduce money. And we would also continue to be responsive as we learn more about this virus. As the Secretary said, this is an evolving situation, and it is a requirement for us to continue this education and continue to build these skill sets. And I know that that's tough, because as Michele pointed out, this is not something any of us were trained to do, and most of us don't have the capacity to take this on. And so I would just say, moving forward for us, communication, absolute communication at all times. And that means obviously not just out to our constituents, our stakeholders, our clients, but also in our communication with the state. We do a lot of work with DOT, we do a lot of work with the MBTA, and we do a lot of sharing, because we connect with both of those services with our shuttles. And so I think these are the kinds of things that we have to, as an industry, focus on, or we're not going to be able to come back to the level that we did before. And I think in Massachusetts, that is a very dangerous proposition, looking at the traffic congestion we have. And then lastly, something the Secretary had talked about is equity. I believe that public transit is a public right. And even in situations like this, and even more importantly in situations like this, we need to make sure that the communities have those options and have that access, because now our communities are suffering in many different ways. And it is our responsibility as service providers to be there for them. But to do that, we need to make sure that our services are as safe as they can be, and make sure that when people are coming back, that those services are an option. Or otherwise, I can't imagine not only what our economy will look like, but what our traffic congestion will look like as we start to move into that new normal. And I think we are very optimistic that we're going to get there. And I think if we continue down this path and continue to the focus on this communication and safety, we are going to come out of this in a much better position than I think we went into it, because I think we know so much more now. We know so much more about how to protect our riders and how to protect our communities. So I'm very optimistic that not only are going to people come back, but they're going to come back to a much better situation, and we are going to be much better at our jobs as transit providers and transportation planners.
Thanks, Monica. That's a great way to end. Really great insights about how important it is that we all essentially work together. I'm paraphrasing, but we all have a responsibility to one another. And really, it is the best and fastest way through this. And also, one little insight that you don't waste your time worrying about things you can't control. They'll only frustrate you. So with that, I think, Stephanie, I think we're at time. So I'm going to turn everything back over to you, and then I'm going to listen and ask you what the next step is.
Well, first of all, thank you to everyone. This has been great. I think we started it with the idea of we want to really focus on the opportunities, and I love the meetings where I end them feeling better and more confident than when we started, and I feel that way, and I think it's because people, they're doing their jobs, they have a plan, and I feel confident in the work that you guys are doing, and that's happening at DOT. So I think you're right, Monica. I think we're gonna go to the other side and be better off than where we started. So I'm looking forward to that day. So thank you to our panel. Thank you to Secretary Pollack and her team at DOT. A lot of great things are going on there. Thank you to our sponsors, the BSC Group and Transaction Associates. We greatly appreciate your support. We will be sharing the presentations with everybody who's on the call today. So we'll send that out to you as well too. And what we'd like to do now is move everyone. Well, first, thank you for attending. If you have a 3 o'clock deadline, certainly, I guess this is the end of the official webinar, but what we'd like to do is move from a webinar to a meeting. And if you'd like to join the discussion, we're going to move everybody into the meeting section. If you want to just eavesdrop and hear what the conversations and the questions are, just keep your camera off. If you want to participate, turn your camera on. Sean, does that work for you?
It does.
Okay, and I know, while we're waiting for people to move over, and we will, I know you had a number of questions as well too, so maybe, do you want to kickstart on the after webinar discussion with Monica and Michele, and then as people come on board, they can jump in with questions as well too. How's that sound?
Sure.
Okay, great.
All right, let me know when you want me to start with the questions. And
Start now. We'll just, as everyone jumps on, I think we could start right now.
Okay, so Monica, I would say when we all got the order / request to stay home, I think it was an order, and we all had to kind of alter the way that we were doing everything. We all had to learn very quickly, kind of how to adapt, and etc. So people started staying home, but you had a lot of people that still needed to get to work, to do the very important work that they needed to do so that we could find a way out of it, specifically some of it relating to getting a vaccine. So how has that all evolved from the time when we first were getting into that to where we are now today? From your perspective as a provider of service, and then maybe from the rider's perspective as well, based on your interpretation or your impression of it.
Yeah, I mean, I think in the beginning, even for the life science companies, everyone just kind of stopped because no one really understood how to control this. And so I would say, the laboratories, most of them just shut down, and they would only have very, very few people coming into the buildings. And they were actually telling people to commute by their own car, single occupancy vehicle car, because they were not particularly sure exactly how this was going to be transmitted. I think now that we're moving into this and you have so many life science companies working on the vaccine or working on related projects around the vaccine, they are coming back. And I think for a lot of the companies, one of the things they had to look at was parking. A lot of these companies do not have much parking. And so I think as they were phasing people back in, it was really important for them to understand how they were going to handle the populations coming back. Now, from the rider's standpoint, like I said, most people just went home in March towards the end and didn't come into the office at all as companies were trying to figure out how to continue their work. I think, as I mentioned, that communication, that was going to be the toughest part, so people felt comfortable. And for us, I was talking, like I said, communities, talking to companies, talking to previous riders about, okay, what are some of your concerns? And then going through and addressing them. I think having the in-station staff, I think also making it clear on our website and in publications exactly every single step we were taking and being very, very clear on what we were doing started to build that confidence. But I really think probably 8 or so weeks into what we're kind of calling the post-COVID service, people started to feel more comfortable. And I think we really set the standard with the masks, with the partitions, and just hammering over the head that you need to be doing this. And I think it started to build that comfort. I think it's going to be interesting to see how people respond, I think, especially to the increase in infections. And if we're going to have to start kind of back from ground zero, really building back that confidence. But I do feel like we've created a scenario in which people know that every single thing has been thought of and every single step has been made. And I think for the companies, that's also been really big. A lot of their communications departments, a lot of their human resources departments were really struggling to figure out how to communicate to their workforce and give them an idea of what they need to be thinking about. And so us putting together those prepackaged communications and sending that out to them was really, really helpful. And I think as I said, as companies continue to reopen, I think they're going to not only be shifting back to some of these alternative forms of transportation that they can better control than people carpooling, et cetera, but I think they're also going to be adding additional services as they realize that the way we work is changing drastically and the way they need to protect their employees is changing. So I actually think we're going to start seeing more shuttle services and more kind of the hybrid services where you're having a shared shuttle, but then you're also having your own dedicated service.
Excellent answer. Michele, kind of a play on the same question. So, you know, from where we began, how did you have to change your approach from what you were doing to when you began? And, you know, kind of how has all that worked out? And then given what you've learned since the whole shutdown began till now, how does that affect your business going forward? And, you know, recognizing that it's all need-based. So what are the things that you're going to be doing differently based on the changing needs of your constituents?
Yeah. And I think, you know, while it's true that most people just sort of went home around that mid-March, sort of end of March timeframe, for us, we had a number of clients that were providing essential services. So we actually never stopped providing services. We were only providing, you know, for a much smaller number, but so we definitely had to learn on the fly. And we you know, the protocols and the information that Monica put together are absolutely fantastic, and helped so much with details. But there was sort of an interim period there where we were having to do a lot of our own research and figure some of this stuff out on the fly. And so I think the key is, you know, the flexibility and the being able to incorporate new information as it becomes available, because sort of in the beginning, you know, much wasn't known at all, right? So we were doing the best we could to come up with what cleaning protocols should look like. We knew obviously wiping down high touch areas was essential. You know, we knew we had to get the driver separated from, you know, everyone else on the bus. That would be the safest thing to do. And we knew that the masks were kind of critically important. But from there, so much more information has become available on what are the most effective cleaning products, what are the most effective processes for cleaning, what is the optimal frequency to clean. So we've sort of gone from, you know, it's very much an evolving situation where new information is becoming available all the time, and it's on us, you know, to stay on top of that. and to try to understand what we can do. And I think for us going forward, I completely agree with Monica. I think that what we're seeing is things are slowly coming back, and customers do have some confidence in the fact that, you know, when you're just putting your own employees together on a shuttle, that might be a good solution for the short term for people. You know, people need to feel confident getting back on transit because so many of our shuttles connect from there. But I think that there is this sort of understanding that, you know, when you're following all these protocols, you're doing it to try to build people's confidence and make them feel safe in the choice that they're making to get on the service that you're providing.
Thank you.
I think that that's what we see going forward.
So Sean, I just want to throw out there, if people have questions, they can either write them in the chat or they can raise their hand. And we do have one question already.
Yeah, I was just going to read that one.
Sorry.
No, that's fine. It's great. So one of our listeners, I don't know if he's camera shy or not. There he is. He's waving. He's not camera shy at all. He's interested in what panelists think advocates can or should be doing during this new reality. So either Monica or Michele, or both of you, if you could tackle that, that would be great.
I mean, I
Thanks
think
for the
it's,
question, Josh.
yeah, I mean, I think it's just educating themselves, but I think also creating new partnerships with, I think, DOT, new partnerships with the MBTA and all of us private providers, because I think they have a particular stakeholder group, they have particular communication channels that would not normally be used for this type of information. And I think the other opportunity we have as organizations is to work with them to better understand the populations they're serving. So whether that's advocacy groups that are pushing for more alternative transportation options, whether they're pushing for fare relief, whether they're pushing for full spectrum housing, all of those have to do with transportation. They're all interconnected. And so I think the advocates, I think, need to reach out more. I think we need to reach out more, even more than they do. But I do think it has to start being a conversation about how these play into each other and what choices do each of us in our different sectors need to make, and how are we responsive to those populations, because those advocates exist because those populations need help. Those advocates exist because there has been some gap in the services that have been provided, whether by the state or whether from the private sector. And so I think now, more importantly than ever, we need to create more coalitions of not just transportation, but coalitions of all of us who are providing the services that our communities need.
And I think, you know, just prior to this, we had seen the, you know, the state's the workforce transportation program and the community connections program, and now we're seeing the next round of the community connections program. I mean, providing these transportation services for employers long-term, it's expensive. And so I think, you know, the help there in promoting these public-private partnerships where the businesses are making a contribution, but where there are opportunities for grant funding to help get services off the ground and show their value, I think that's going to be really important going forward as well.
Excellent. So I have a question. I think it was one of the ones we came up with ahead of time. But the secretary threw kind of a curveball at it, you know, which was, you know, viewing this through access as opposed to mobility. How can we ensure that we are planning transportation services as holistically as possible and not in silos based on town boundaries, employer boundaries, etc.? How do we all work together? You know, because the access question is sometimes local, and you guys definitely deal with more the localized element. So it's a very fair question. Is, you know, how do we do that while also providing, you know, the access to all that we want to provide? The equity question. I'll start with Monica there, please.
Well, that's a fantastic question also. I mean, I think it, you know, kind of based on my last answer, is really talking about going from transportation centric planning, because, you know, I'm a transportation planner. I work with a lot of transportation planners. We think about transportation modal. We think about transportation networks and how they play together. I think what we need to be focusing now on is regional planning, looking at the corridors, looking at the regions, and once again, getting an understanding of which each of the municipalities are suffering from. What are the private sector? And I think that goes to a lot of data collection. we had worked with MassInc to get a better understanding of how employers were responding and what changes they were making to their business models in response to COVID-19. And now we're also working with municipalities to understand what their residents are needing to be able to connect to potentially new employment opportunities as we've seen unemployment rise, connecting with education opportunities, especially as the educational landscape has changed so greatly. But it's a lot of planning and a lot of talking. But I think the data is so incredibly important right now, because if you think about it, our previous census data is kind of pointless. The transportation models, everything pre-COVID is kind of thrown out. So how do we build these better relationships? How do we collect that data? And more importantly, how do we share it? The sharing of data has been really big for us, because I think in the beginning, a lot of people were trying to make things, proprietary. Like, well, these methods are proprietary. This data we're using for our decisions, but it's proprietary. And I think that's another really big step, because what you're doing is, if you're not sharing that data, running these software programs, collecting this data is incredibly expensive. And from an equity standpoint, you're basically saying access goes to the highest bidder. So I think we need more data. I think we need to make all of that data open. And I think we need to be thinking regionally. We need to be thinking across those municipal borders, as you said, because it's not like the virus stopped at a border. And it's not like people don't ever commute across those borders. So I don't know why we would continue to do our transportation planning similar to that. And like I said, it needs to move beyond transportation planning and really get into regional planning, because that takes into consideration housing, economic development, all of the health and human services, all of the things that are so intertwined with transportation. So it is, quite honestly, I think Michele kind of alluded to it, it is a reimagining of the way we do our work, whether that's in the service, in providing the services or planning for the services. Everything has to change, and we have to be open to making that change and be open to being more collaborative, whether or not we financially benefit from it.
What a rich answer. Seriously, I'm really, really impressed by that. The sharing data, really, really important. And the observation about, pre-COVID and what it means today and going forward, and how it may not matter much at all. We really do have to reimagine. And that's really, one of the things that I think we need to learn. We have a responsibility to learn coming out of COVID. Is we can't expect that things are going to be the way that they were. People take comfort in what they're familiar with. We have to find a way of getting people comfortable with and confident that we still have this going forward. So that's a great answer. Michele, your thoughts on the same question, please.
Yeah, I kind of highlighted three things that Monica just said that I want to just, really hit on. Coalitions, building coalitions, looking at things from a regional perspective and being more collaborative. I think that what, transportation insiders know, that transportation planning is so siloed, in many regards. Commuters go here, seniors go here, kids go here, and that's how we plan our transportation. And we just have to break out of that going forward to be effective. And we need to bring stakeholders into this. All of those groups need to be represented in the process, or else we can't take a holistic approach to planning this. Sometimes we talk about people getting a seat at the table and making sure that all these different groups have a seat at the table. But I think most of the people that need to be part of this conversation don't even know where that table is. And we have to find a way to bring them there to have these more productive conversations going forward.
Excellent. Does anyone have any questions from the broader group? Anyone want to raise a hand? Anyone want to come off and be on camera?
John, I did see that Andrew Jennings from the LRTA wrote a question as well too. And Andrew, I would have been surprised if you let this meeting go by without asking a question.
Very
So
good.
if you want to read it or just state it.
I've got it. I'll read it word for word. Thank you. Current transportation in Massachusetts is inherently biased. Although revenues are down, fare increases are on the table, but gas taxes are not. How can these bias be reduced, particularly in modal shift in auto? If the modal shift is to auto, we have no chance of meeting climate goals.
I'm always in support of a gas tax. I was very heartbroken. Basically, every time it's failed, I'm very, very heartbroken. I hope some people in the legislature are on this right now, because I think that has to be a focus of theirs. And I think a lot of education to the residents on why it would benefit them to move in that direction. Obviously, I'm in a very awkward position as vice chair of the Fiscal Management Control Board to make any comment on service cuts. But I think the one thing I will say is that conversation is going to be kicking off for the board on Monday, where we're really talking about what parameters we're going to be using. I think for me, the biggest thing is making sure that the resources are going towards the transit critical populations, that the resources are going to the services that are needed. And I think that is the lens by which I'm going to view any adjustments to service, any cuts to service, is how do we maintain that safety line for the people that need it? And that's talking about people who are essential workers, who don't own cars, who only have one car, all of these different populations that need us the most right now. But I think unless we start talking more, it's not even progressive, just talking about any other user fees other than assessments to the communities, fares from the individuals, and any other contributions that the municipalities have to make, then we're not going to be able to address this. And that's before you even get into a discussion of the federal funding, which I think would be kind of depressing to talk about today. But I think we need more user fees, and I think we need to get more creative in the way that we do that, and not putting it on the back of people who are already making the better commuting choice.
Yeah, no, great answer. I am not a big tax person, but I am a big, I definitely see the benefits of the gas tax. I think if you just look at it from a purely just objective perspective, the price of gas can change in a given day or period or a week, nickels, dimes, quarters, dollars. And, the gas tax would be pennies on the gallon. I agree with something that somebody said earlier about access to public transit being a right. I think it is, and it should be. Otherwise, we're just depriving people of realizing their potential. So if you view it through that lens, it becomes very easy to justify a gas tax that is committed to being expended on transit, which would also get to one of one element of Andrew's questions, which is how it relates to climate goals, which would be taking cars off roads. Same question to you, Michele.
Yeah, I'm gonna kick it right back to what the secretary said in her presentation. There's no way to address climate goals without looking at transportation. And because of that, I think everything has to be on the table. Everything has to be on the table as part of this conversation. And, there are choices to be made. I don't envy, the position of the control board and MassDOT and the MBTA about how this is going to be addressed and how they're going to find balance between what the budget looks like and providing critical, essential services to people that they need and that the economy needs.
Excellent. Great question. Great answer to that question. Stephanie, did you have anything else here? Because I think we're right down near the end where I think you wanted to close. We're
Yeah, no, I'm going to close it with again a thank you to our panel, Monica, Michele, Sean. Thank you all for coming, for your insights and the positive spin as well too. So I appreciate your time, and I think this is the beginning of many conversations that we're going to be having over the next many months, years. So thank you for that. And to our sponsors as well, to the BSC Group and Transaction Associates. We do have a number of other upcoming events as well too. We can send you links to them, including our subcommittee meetings, transportation. We have a subcommittee on transportation, workforce development, infrastructure. They're all related as well too. So if you're interested, we'd love to have you come. I know that there's also another event on November 10th. We have a real estate event as well as an event with Green International on AI and how to use. Actually, Emily, you're on the phone as well. You're on this call as well too, so maybe you might have better information. There you are, to explain the event on November 10th.
Hi, everybody. Yes, so Green International affiliates. We're a civil structural engineering firm in Westford, Massachusetts. And on November 10th at 12:15, we're going to be presenting a webinar about how we use artificial intelligence to use our pavement management, the benefits, how it's cost effective. And we will be touching upon 2 of our case studies that we recently done within the past year. And we're going to highlight the successes and our approach to each town's pavement management. So in the chat, I added a little description about what we will be focusing on the webinar. And then I also attached the link where you can sign up for our webinar.
Perfect. Thank you. And so thank you for that. A lot going on, a lot of events. But I guess really the closing remark is, if you haven't already, please go out and vote. And hopefully, yeah, we'll just leave that at that. Go out and vote. So with that, thank you for a positive, and I saw some comments here as well too. Thank you for a positive, uplifting conversation, and we appreciate your time. Sean, thank you.
Thank you. Thanks,
Michele,
everybody.
Monica, thank you. And have a great day. Take care. Bye, guys.
Thanks, you too.